What are the signs and symptoms of dry eye disease? In this video, I'll go into my top 5 common symptoms that people have when describing their dry eyes, and we'll also take a look into my top 5 clinical signs that I look for in the exam room. Hey everybody, my name is Dr. Natalie Chai. This channel brings you the latest science-based education and treatments in dry eye disease, myopia management, and specialty contact lenses to help you understand why it should matter to you for optimal eye health, function, comfort, and even beauty. If you remember from my first video, Dry Eye Disease 101, I shared with you that most people don't actually feel like their eyes are dry when we are asking about their dry eye. I quickly found out again that I was just asking the wrong question. This video could go on for hours if I really wanted to get into every single detail on all the possible symptoms and signs related to dry eye disease. But on second thought and on reflection, there's really always that handful of concerns that keep coming up as a commonality from patient to patient. So without further ado, and in no particular order, here are my top 5 symptoms of dry eye disease. Number 1, it feels like there's grit or an eyelash that's constantly in my eye. Number 2, my eyes are always watering or tearing up constantly. People think I'm crying all the time. Number 3, it feels like there's gunk or sticky buildup in and around my eyes. Number 4, my eyes feel like they sting or burn, sometimes even when I put lubrication drops in. And number 5, I can't wear my contacts comfortably for long periods of time as I used to. From these descriptions, you can see that it has nothing to do with feeling dry, although there are certainly patients who do describe it that way. There are different sensations of pain, soreness, fatigue, and interruptions to quality of daily life. And that's the key. There's a marked decrease or change to how a person goes about doing life day to day. A very important diagnostic tool in our toolbox are the usage of questionnaires. There are 2 validated questionnaires from the TFOS DEWS-2 study, and they are, number 1, DEQ-5, or the Dry Eye Questionnaire 5, and number 2, the OSDI, or the Ocular Surface Disease Index. I use both of them for different purposes as they do give us very important information. Let's take a closer look at each one. The DEQ-5 is super convenient as it only has 5 questions, so it's not as daunting to the patient. Because you know how we all just love paperwork, right? Nah. The questions focus on 3 general categories of eye discomfort, eye dryness, and watery eyes. Each question is given a severity rating from the patient, and then the total is calculated from that. An abnormal score is a total equal to or greater than 6 out of 22. Now looking at the OSDI, it is a little more detailed with 12 questions, but still quite simple to complete. Again, there are 3 general categories. This time, the focus is around symptoms, common daily activities, and common environment. And what I love about this questionnaire is that in addition to measuring dry eye disease, it incorporates the effect on vision-related function. The OSDI is assessed on a scale of 0 to 100, with a score equal to or greater than 13 considered abnormal. Let's carry on and move on to my top 5 signs of dry eye disease. This was especially hard for me to narrow down to only 5 because all are key pieces to the puzzle when diagnosing dry eye disease. So I finally finalized on this list because the optometrist doesn't necessarily have to have all the fancy equipment to be able to confidently diagnose dry eye disease. And what they really need is just their microscope and their day-to-day supplies. That just brought me back to where I started just even a couple years back, where I was still able to successfully manage my patients. So here they are. Number 1, fluorescein tear breakup time, or the FTBUT. Your optometrist has probably at some point put a yellow dye in your eye. This is called the fluorescein strip. Do not confuse this with the dilating drop. The yellow dye doesn't cause any side effects outside from a noticeable yellow tinge to your vision for only a few seconds. In the context of dry eye disease diagnosis, The fluorescein is applied to the eye, and after about 1 to 3 minutes, your optometrist will observe through the slit lamp microscope how quickly your tear film breaks up. Now, I would typically instruct and say something like this. I will count down 3 blinks with you, and on the 3rd blink, I'd like you to keep your eye open for as long as possible or until I tell you to stop. The test is stopped when either the patient blinks or when I note the presence of black streaks on the ocular surface signifying breakup. I am silently counting the seconds of how long this takes. So an abnormal result is an FT-but of less than 10 seconds. This test is only used if the optometrist does not have a means to measure something else called the non-invasive tear breakup time. In this variation, no dye is used, and so it provides a more accurate and true finding. Number 2, fluorescein ocular surface staining, or otherwise known as superior punctate keratitis. The nice thing is we can also assess this sign at the same time with the FT-but, or the fluorescein tear breakup time. We are looking for corneal spots as they are highlighted with the dye. I like to describe them as having a texture of kind of like sandpaper, as it kind of looks rough on the surface. A positive test is having more than 5 corneal spots on the cornea, or more than 9 spots on the conjunctiva. This is the clear tissue lining the eye that covers the sclera, which is the white part of the eye. In the TFOS Deuce 2 report, any presence of staining is actually a sign of late dry eye disease. Number 3, anterior blepharitis. So this is inflammation of the eye occurring on the outside edge of the eyelid where the eyelash is attached. Underneath the microscope, the optometrist will typically see flaking and crusting along the base and in the eyelash. For the patient, this is usually one of the main causes of redness, puffiness, and itchiness of the eyelids. There are several types of anterior blepharitis, which we'll break down real quickly here. The first is called Staphylococcal. This has a bacterial origin and has a crusty yellow ring-like look to the debris. The second type is called Seborrheic. This can be described as more of a dandruff-like appearance. The debris looks more flaky and greasy and usually involves the skin around the eyes. And the last one here is something called Demodex. Brace yourselves. Make sure you have stopped eating before continuing. These are parasites that make their home in your eyelid and lashes, specifically in the hair follicles of your eyelashes. The hallmark appearance of the debris are cylindrical dandruff that almost look clear, but they also have like a waxy appearance to it too. The misconception is that it is only found in the elderly. However, we're seeing it more and more in younger adults, especially in females who have eyelash extensions. Number 4, posterior blepharitis, or also known as Meibomian gland dysfunction, or MGD. This is inflammation of the eye occurring on the inside of the eyelid that touches the eyeball. I touched upon Meibomian gland dysfunction in my last video, and we learned that it is where the oil glands or the Meibomian glands in the eyelids become abnormal and stop producing the quality oil necessary for a healthy tear film. What we see underneath the microscope may be something called Meibomian Caps. Literally, the exit points along the lid margins are capped with these oils as they start to back up and the flow essentially slows to a halt. These caps can be clear domes, and in the more severe cases, we notice a thick white or sometimes even a yellow appearance to these caps. Another sign we would see that point to posterior blepharitis is a frothy and foamy tears. This comes from a process called saponification, where bacterial waste products and enzymes interact with the oil part of the tear film to produce the soapy discharge. Usually when this happens, we also note the irregularity and the smoothness of the lid margins. We sometimes use the term scalloped lid margins to describe the roughness. Number 5, ocular telangiectasia. In other words, spider veins. We see these traveling right along the lid margins, both upper and lower. When we see these, a condition called ocular rosacea immediately goes up on our radar. The presence of these veins let us know that there is an underlying inflammatory condition causing their dry eye symptoms. Here, we know that the focus should be to address the inflammation as the priority when we're looking at dry eye treatment. Here's a sneak peek to the other signs that are just as important. These include tear osmolarity, inflammatory MMP9 biomarker, meibography, Schirmer test, Meibomian gland evaluator, and the non-invasive tear breakup time. I'll have separate videos introducing you to all of these amazing tools we use and what we use them for. So there you have it. That was my quick top 5 list for both symptoms and signs of dry eye disease. I hope you have a better idea on what to look for around symptoms and also understand what we're looking for when we're sitting across from you looking through the microscope. Do you experience any of these symptoms yourself? Or let me know if there's something else you are experiencing and you want to know if it means you have dry eye disease. That's it for me today, and I hope you learned something new. If this is your first time to the channel and you're enjoying learning about dry eye disease, make sure to click the subscribe button and the notification bell to make sure you don't miss my new video every Thursday. Take care of your eyes, and we'll see you next time.